Welcome to the Enlightened Pet Behavior Podcast. I'm your host, Susan Light. In a world overflowing with conflicting evidence and often misguided information, my mission is to be your trusted source for accurate, kind, and truly effective strategies to understand and shape your pet's behavior. Join me as we shed light on common challenges and work to foster a deeper, more harmonious bond with our beloved furry family members. If you find the show helpful and enjoyable, please consider showing your support. Subscribing, following, rating, reviewing, and sharing with your friends takes just a minute, but it significantly boosts the show's visibility, helping more pet parents discover it. Thank you. Let's get into it. Today, we're talking about senior pets. If you're lucky enough to have your pet live long enough to hit their senior years, it comes with its own set of challenges. What counts as a senior? How can we support them so they can have the best quality of life possible? How can we deal with anticipatory grief? We'll get into all of it. My guest is a veterinarian and senior dog expert who has made it her mission to help senior dogs stay happy, mobile, and pain-free while giving their families peace of mind. She's the creator of Golden Years Glowing Health, a supportive vet-led program for navigating your dog's senior years with confidence. You're giving them everything they need to thrive. Please welcome Dr. Angela Youello. Welcome to the podcast.
Thank you so much. Thank you for having me. I'm very happy to be here.
I'm super excited. This is a topic that I wanted to talk about for a long time. What is the definition? We'll just start with, because we're going to be talking about senior dogs. What's the definition of a senior dog?
That is a great question. So many people ask this, and there actually is not really one well-defined answer. Depending on who you ask, you're going to get different answers. I think that generally the consensus seems to be that a senior dog is considered to be a senior in the last roughly 25% or so of their expected lifespan. That can be a little hard to know for sure with mixed breeds, for instance, since we may not know exactly what type of mix they are, and therefore what their life expectancy would be. But that's the easiest, clearest, I think, general rule of thumb. And as you probably noticed, that's going to vary a lot depending on the size of the dog. So a really small dog that might have a life expectancy of 15 or 16 years may not be a senior until they're 12, whereas a giant breed dog, a Mastiff, Bernese, who may only have a life expectancy of 8 or 9 years, they could be a senior by the time they're 6.
Yeah. That's the worst part, is how short their lives are.
The only bad thing about dogs, in my opinion, is that they don't live longer. And it really irks me that we've been breeding for so many thousands of years for such ridiculous... I mean, I love my Frenchies, but come on. Why were we breeding for those characteristics if we'd been breeding for longevity that entire time? Imagine how long dogs would live nowadays.
Right?
Yeah.
We're so dumb as a human race.
You
don't deserve dogs. That's what I thought. So that's really, I think some people might know that dogs have different life expectancies depending on their size. Or maybe that's news to the people listening. But yeah, unfortunately, the larger they are, generally speaking, the shorter their life is expected to be. Obviously, nothing's guaranteed, right? We're not guaranteed to get our dog into the senior years. But what could we do while they're young to increase their chances of getting there, or make it have better quality of life when they get there too?
There are a lot of things that we can do when they're young to help them have a better chance of living a long, healthy life. I would say the number one most important thing, which nobody ever wants to hear about, but I'm going to get on my soapbox anyway, is weight management. Because
I knew you were going to say that.
Yeah. Oh, there you go.
Number one thing, yeah. For humans too. I always feel like the pot calling the kettle black, because I'm carrying some extra pounds whenever I'm the best thing you could do is keep them at a healthy weight.
Right. But yeah, I think people are more aware of it in the sense of, obviously, it putting more strain on arthritic joints and being a mechanical issue. But I think what a lot of people don't recognize is that fat is not just sitting there inert. It's actually an endocrine organ. It is producing pro-inflammatory mediators, and it is increasing inflammation throughout our dog's entire bodies and causing damage. So, if I could do one thing for a dog to give them a better chance at a long and healthy life, it would be to keep them toward the low end, even not even in, toward the low end of their healthy weight range when they're young.
Yeah. So, what are some signs that your senior needs help? I see a lot on your Instagram of like, don't assume they're just getting older, right? When you see these things happening, what are these things that we should be bringing up to our vet or doing something about that? We can do something to make their lives better as opposed to just being like, oh, I guess they're getting older.
There are a lot of things that we can be looking out for. I would say, generally speaking, you know your dog best. So if you think that something is different with your dog, even if it's subtle, your vet wants to know. And I have people all the time bring their dog in for, like, literally the presenting complaint is, he's looking at me funny. And they're so apologetic when I walk into the exam room. And I'm like, do not apologize. If you think that your dog is not himself, that is meaningful information. And I want to know that. So anything your dog is doing that is not normal for them, especially as a senior, is worth bringing up to your vet. Some things that I think commonly get overlooked would be decreases in mobility, in terms of being a little bit slower on walks, hesitating before jumping up onto the couch or the bed or into the car, hesitating before going up or down the stairs, being a little bit just sort of stiffer or creakier when they get out of bed first thing in the morning. Those sorts of mobility changes are very important. Those are often signs of chronic pain that we can treat if we notice those signs before it gets to something really obvious like overt lameness.
Mm.
Um, Changes in behavior are another very commonly missed or misunderstood sign that we can potentially intervene. Um, Changes in their sleep wake cycle. Sometimes dogs previously were very good sleepers, and now all of a sudden they're waking up multiple times overnight and not seeming to really need anything in particular. They're just kind of restless overnight. That can be a sign of cognitive dysfunction. Um, and yeah, there are so many. I have a free guide that goes through a whole checklist of things to watch out for. If anyone is interested in that, I can give you the link to put in the show notes.
Absolutely. I would love to put that in the show notes for people because I feel like a lot of times they're like, oh, yeah, they're just getting older and they just kind of accept that,
Yeah.
especially the mobility things that you're talking about. They're like, yeah, he's old. What do you expect?
Oh, 100%. I have so many people tell me that they don't think their dog is in pain, that they're doing X, Y, and Z abnormal thing, but they don't think they're in pain because they're not crying or they're not uh, obviously limping. But when I see the dog, they obviously are in pain and they deserve to be treated for that.
Yeah. And I would also say find a vet who takes you seriously because I think more often than what you're talking about, where like, I don't think the dog's in pain, is I'm sending my clients to their vet because we think their dog is in pain. And the vet's like, I don't think so. I think they're fine. Um, I think it's important to find a vet that takes you seriously, your concerns. So, if you get brushed off, you have the option to go to a different vet.
Oh, absolutely. That's another soapbox of mine. Never, ever, I have a few. This is a big one, though. Never, ever, 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 ever be afraid of asking for a second opinion. No good vet will ever be offended by you asking for a second opinion, because more information is a good thing. And medicine is both an art and a science. So, if you have 10 vets that see the same patient, they may have 10 different treatment plans and they all may be valid in their own way, but they're not identical. And so if you're not getting the answers that you want or the options that you want from your regular vet, maybe this is not their particular area of clinical interest. And it's perfectly fine. And your vet will welcome it, especially if it's not their area of particular interest, if you want to go see someone that does focus on that area.
Yeah. I have a little 4-pound Yorkie client who limps on a back leg. in like squeaks if you pet him there. And his vet doesn't think he's in pain.
Really?
And they did an x-ray. They're like, the x-ray didn't show anything. And she's like, can we do a pain med trial? And he's like, no. And
Oh.
please go find somebody else because you can't. He's like, it's behavioral, so they're coming back to me as the trainer. And I'm like, listen, we've been trying to train this dog for months and he's not making any progress. I'm like, you have to find a vet that will believe you.
Yeah. Oh, wow.
So it's very frustrating.
I can imagine how frustrating that would be, especially because I'm always I understand with human medicine. Like, we have to be more concerned with the things that we're prescribing because for many medications, there is abuse potential for humans. But I have never, in my many years of working in veterinary medicine, had a dog call my hospital seeking. Never. They can only take what we give them. And I think that if all else fails and we're not finding anything that's a reliable indicator that the dog is in pain, but something is just off, it is almost always worth a pain medication trial. Just try it for like a week, 10 days, 14 days. If there's no change, you can always stop it. No harm is going to be done for taking a pain medication for a week or two. But if there is a change, that is very, very valuable information.
Yeah. Well, the only reason she asked for the pain med trial was because I told her to. I was like, you can just ask and then that will sometimes we can't find the source of the pain very easily, but if we can treat the pain, then we can surmise that they were in pain.
Yeah.
But the vet that she took him to was not open to that
Wow.
option. So,
Wow.
and I mean, I can't diagnose the dog, so
Right.
it's tough. That's a soapbox tangent, but it's important.
Oh, and I'm glad you're advocating for that little dog.
Yeah. Are there any things out there, speaking of like trying to do things to help our seniors? I feel like there's a lot of things marketed to seniors. Are there any things that are worthwhile or any things that you're like, definitely avoid? It's just marketing. They don't need that.
The big thing that I would say, well, the big couple things maybe that I would say are just marketing, don't need that, may actually be harmful, actively avoid, would be number one is anesthesia-free dental cleanings. I am a big, big, big opponent of those because the tooth is like an iceberg. So more of the tooth structure for most teeth is actually within the gum line than is actually visible in the mouth. Like, the crown portion is the minority of the tooth for many of dogs' teeth. And when we do an anesthesia-free cleaning, not only are we not even able to thoroughly clean the visible part of the tooth nearly as well as we would if the dog were under anesthesia, but we are completely neglecting the entire rest of the tooth structure that's under the gum line. And then I think it gives people a false sense of security that their dog's mouth looks better because the visible portion of the tooth is cleaner, but there could be an unimaginable amount of oral pathology going on under the gum line that we can only find with x-rays and with an anesthetized oral exam. So I definitely recommend against anesthesia-free cleanings. I feel like those are marketed a little more towards seniors because people tend to understand.
Afraid of anesthesia.
Exactly. Yeah. They're more
Yeah.
afraid of anesthesia when their dog is older. And then another one would be, I don't know that this is necessarily specific to seniors, but grain-free food. That is a marketing initiative. It was, I think, just a way to set more boutique pet food companies apart from their larger competitors. There has never been any demonstrable nutritional benefit to feeding grain-free. And in the last few years, many of those diets have actually been linked to the development of serious heart disease. So I would avoid feeding grain-free. I guess as a segue from that, there are a lot of foods that are marketed towards senior dogs, and they actually are, what they're actually approved for is all life stages. And that is not necessarily optimally nutritious for a senior dog because all life stages food includes growth.
Puppy food.
Exactly. It's puppy food, it's gestation, it's lactation, it's times in their life when they need a super high number of calories because they're metabolizing so many, and senior dogs generally don't need that. Um, so really an adult maintenance food is going to be, in most cases, the most nutritionally appropriate thing to feed them.
Interesting. So even some of the ones that say they're for seniors are not appropriate for seniors. How would you know the difference?
That is an excellent question. I would say when you look at the bag, there should be an AFCO statement where it says which stage of life it's approved for. If it says all life stages, that's not probably a good senior dog food. It should say the AFCO statement should say that it's approved for adult maintenance. There are some prescription foods that are designed for senior dogs specifically. Royal Canin has one or two. Hills has a couple. Purina makes NeuroCare for cognitive dysfunction. Their over-the-counter sort of version of that food is Bright Mind. I fed my own dogs that previously and liked it. So those are options if you do need um, something that's not just an adult maintenance food for your dog. But I think most of the over-the-counter foods that are marketed towards senior dogs often tend to be for all life stages and are actually not nutritionally the best thing for seniors.
Interesting. Yeah, there's a lot of information on a label. I do have a podcast episode several seasons ago. That's the reason I knew all life stages food is puppy food. I didn't know that going in until the nutritionist told me that. But there's a lot of information on the label, so it's good to know like what to actually look for. Because some of it doesn't have that much meaning. Some of the things that are on the label.
Oh, a lot of it is completely meaningless. It's nonsense.
Yeah, it's tough.
It is.
People trying to do the best, and they like, I don't know. So changing their diet a little bit so that they have fewer calories, so they can maintain that healthy weight. That's a good accommodation as they age. What are some accommodations we should be making to our home to make it more accessible? Maybe decrease the chance that an older dog might injure themselves.
I think for home accommodations, the number one thing I recommend is just making sure they have secure footing. Um, Senior dogs tend to lose core strength very commonly, and that's often not diagnosed. And that can affect their balance. It can affect their ability to keep their legs squarely under their body instead of sort of slipping out from underneath themselves. Um, and so they're much more they also may have proprioceptive issues that make them have alterations in their balance. They might be a little bit more wobbly, a little more unsteady. They're more prone, just like elderly humans, much more prone to slip and fall injuries than their younger counterparts. So anything we can do to improve the security of their footing is very helpful. And there are so many things we can do with that. I've had people use carpet runners. So just buying, the long strips of carpet if they want a more sort of aesthetic solution. I've also had people buy bulk yoga matting. You can buy giant rolls of it and then cut it to size and make actually pathways like a little yellow brick road through their house for their dog to walk across that has good footing because, the yoga mat, it's grippy, it's soft, they're not going to slip on a yoga mat. And so that's another solution. There also, if you don't want or can't put things down on your floor, there are things that can go on their feet. Dr. Busby's toe grips are a really good solution. They're these little donuts that go over their nails. And then what contacts the floor is the edge of the rubber donut rather than their toenail. And so that is a good non-skid surface. I like those a lot. They also make products like Paw Friction, which is like a sort of adhesive, just not abrasive exactly, but it's something that you put on their paw pads that gives them a little bit more friction to keep them from falling.
Okay. I knew about the toenail grips. I didn't know about the material that you put on their paw.
Yeah, it's really cool. It has like a stamp pad that you stamp their foot on. I think that's the adhesive. And then you put this powder on top that sticks to the adhesive and then it dries. And then it looks like a glittery paw pad, but it's actually a grippy surface for them so that they're less likely to slip.
Disco seniors. Mm-hmm.
Heck yeah.
Love it.
And then anything we can do to reduce impact on their joints and their spine. I worry about that a lot more with some breeds of dog, like, for example, Frenchies, like I have, are very prone to disc disease. So we have a lot of modifications in our home to help protect their spines. But things like ramps to help them get on and off the furniture. Um, the Help 'em Up harness is a great assistive device for dogs, especially bigger dogs, that it's hard to, if they need help getting on the couch or going up and down the stairs. I don't want to be crouching down and hoisting my 90-pound St. Bernard up and down the stairs twice a day, every day. So the Help 'em Up harness has a handle over their shoulder blades and then another handle over their hips. And so you can just reach down and grab the handle and just give them kind of a, you can kind of spot them or just take a little bit of the load off of them instead of actually having to pick the entire dog up from the floor.
Yeah. So also getting in and out of cars is a little bit too much for them too, right? Like a good ramp or steps in and out of the car would be good if they're still going places.
Oh, yeah. Anything we can do to reduce the amount of jumping that they have to do, because jumping up, they have to really extend forcefully off of their back legs. So that puts a lot of strain on their hips and knees. And then jumping down, they're bearing the brunt of that impact on their wrists and elbows and shoulders. So if they have arthritis in any of those joints, getting up and down from elevated surfaces is going to be difficult for them. So, yeah, ramps, stairs, the Help them up harness, anything we can do to just help take some of that load off of them is going to be productive. I will say that a lot of dogs seem to be nervous about ramps specifically. Um, so whenever I have people introduce them, try to have the ramp just be flat on the floor for a while and just like give treats on it, feed on it, let them walk on it voluntarily to get used to the idea of the ramp and the surface of the ramp before it's actually inclined on the couch. Because I feel like once a dog decides they're afraid of something, it's a lot harder to teach them that it's not scary than it is to just not have them be afraid of it in the first place.
Totally. What are some mistakes that you see people making with their seniors?
I would say the biggest mistakes I see people making are letting them get overweight that will shorten their life expectancy, neglecting their oral health. Even if you have never brushed your dog's teeth, senior dogs can still learn to tolerate toothbrushing or other forms of at home oral care. Um, Even right up into their teens, many dogs can undergo anesthesia as safely as a younger dog. We have such balanced, safe anesthetic protocols nowadays. We have so many options for anesthesia that we can mix and match different medications to use very, very low doses of each medication so that the risk of adverse effects is a lot lower. Um, Versus, way back in the day when we would have to hit them hard with one agent to get them under anesthesia. Nowadays, we give them tiny little bits of this and that and the other thing, and the side effects are minimal. Um, the incidence of adverse effects under elective anesthesia, like for a dental cleaning, is extremely low. And that really improves their overall health so enormously because we're removing this very significant source of inflammation that's constantly plaguing their body. So I think being too afraid of anesthesia so that we're not doing dental cleanings when they're needed, I think that's a mistake. And then just chalking things up to quote unquote just aging when it's actually a sign of a treatable problem like arthritis, other forms of chronic pain, cognitive dysfunction. All of those are things that we may not be able to cure them, but we in most cases can improve the situation and improve their quality of life.
Absolutely. So I have a couple of mm, sad, saddish questions to
Mhm.
kind of end with. How do you feel about adopting a senior pet? Because I think mostly we've been framing the conversation of a pet that you're spending most of their life with them, whether you got them as a puppy or a teenager, a couple of years old for the shelter. You got to have those prime years with them. We're seeing senior pets show up in shelters. How do you feel about bringing in a pet that's already in their senior years?
I love the idea of adopting senior pets. I think they make amazing companions. They're past that whole puppy, chew on your shoes, chew your electrical cords, pee in the house phase. Um, they're just, they're adults. They're mature, they're calmer. They make wonderful, wonderful companion dogs in most cases. And I do think it's hard to adopt a dog knowing at the outset that you're probably only going to have a few years with them. But I think that that's balanced out by knowing that if you don't adopt them, they might spend those years in a shelter instead. I would rather adopt a senior and then know that I'm going to lose them than have to think about that dog living out its senior years without a family to love them.
Yeah, for sure. And then there's something called anticipatory grief, right? If you're living with a senior that's faculties are fading and you're feeling like you're in the end stages of their life, you know, we as humans tend to mourn them in advance. Do you have any recommendations for someone in that situation?
I love that question. So my first senior dog before I was a vet, my first dog, his name was Casey. I adopted him. I was in graduate school actually. I wasn't even planning to go to vet school. I was going to be a scientist. And I adopted this dog and I loved him so much. And when he was a senior, I was so stressed out and anxious and just sad the entire time. Like it wasn't just when I thought about him that I was sad. I was like stressed and anxious and sad the entire time, even when I was doing things completely unrelated to my dog, because I knew that my time left with him was limited. And I didn't know it at the time. Now I know that that was anticipatory grief, but it was so incredibly stressful. And he's actually a big part of the reason why I became a veterinarian was to have the knowledge to be able to take better care of my own dogs and also to be able to spare other people from having the experience that I had. Because I think a lot of it for me was just not knowing what to do. I didn't know how to tell if he had a good quality of life. And then I didn't know what to do about it if it wasn't as good as I wanted it to be, because there were so many, and it's even worse nowadays. That was back before the internet was as big as it is now. Nowadays, there are thousands of influencers and supplements. And, like, you can't turn around without hitting another recommendation for something you should be doing for your dog. And how do you know if it's worth doing? How do you know if it's going to make a difference? And I didn't know. So I would try this, I would try that, I would try this other thing. I had no idea if any of it was helping, and it was so stressful. It really affected my quality of life and probably his. And also I didn't enjoy my time with him as much as I could have. And I look back on that. He died, let me see, 13 years ago, and I still think about him all the time and just think that I wish I could have really savored that time with him instead of being worried about him all the time. So I think knowing what goes into quality of life for your individual dog, because there are some things that are sort of universal, but there are other things that are individual to each individual dog. Knowing what goes into good quality of life and then knowing which interventions are really worth trying and being able to cut through the noise of all the things that are out there that are not helpful and that are going to be a waste of time and money. I think that helps the most, because then you know that your dog has a good quality of life. If they don't have the quality you want for them, you know what your options are that are going to actually be helpful.
Yeah, for sure. I don't know if we want to end on that note. I'm trying to think of another question. We don't have to be sad at the end. Because
I don't think we even have to be sad about that, though. I honestly, so I talk about this a lot. So you may have seen this on my Instagram, but I had a rehab patient named Jazzy years ago who literally changed the way I practice medicine. I saw her every week. She was a big dog. She had arthritis in pretty much every joint I could palpate. And they would like push her around in a stroller for her evening walk. They would take a stroller with them. So she would walk as far as she could. And then if it was a nice night, they would just put her in the stroller and keep going so that she could enjoy all the smells. It was so sweet. But so, and she was a rehab patient. So like for rehab, it's a lot of hands-on, laser therapy, joint mobilizations, stuff like that. So her dad was always there while I was working with her. So we would chat. And one night he said um, that he had a realization recently that old age is just as valid a stage of life as puppyhood, and they're trying to enjoy it just as much. And I literally, it was like a bolt of lightning hit me. And I realized this was years after Casey had passed, but I realized that I had been seeing his last couple of years as like a countdown toward his inevitable end. And I could have been seeing them as the sweetest part of his life. And so this conversation with Jazzy's dad changed the way I see senior patients. It changed the way I practice medicine. It changed the way I treat my own dogs. And it really can. Your dog's senior years can be you've built this relationship with them. You know them better than anyone else in the world. And you've had a lifetime of love together. Even if you adopted them as a senior, you've still had all of that love that you've poured into them, that you've gotten back from them. You have this wonderful relationship. And their senior years really can be the sweetest part of your life together.
I love that. It's so true. If we're fortunate enough to get senior years with them, we should try to enjoy them as much.
Absolutely.
Yeah. Thank you so much for this chat.
Oh, thank you so much for having me, Susan. That was wonderful.
Thank you for listening to the Enlightened Pet Behavior Podcast. I hope you and your beloved pets have found valuable insights for a more harmonious life together. Please remember that this podcast provides educational information only and is not a substitute for professional veterinary or behavioral advice. If you need personalized support, please don't hesitate to contact me and we can explore how we can work together to achieve your pet behavior goals. You can reach me at enlightenedpetbehavior.com or via email at susan@enlightenedpetbehavior.com. Special thanks to Mac Light for composing the podcast's music. You can find him at maclightsongwriter.com. All these are in the show notes for you. Treasure those fur babies, and I'll talk to you next time.